AMP2.tv presents Tell Us Your Business, where you're invited on the air to tell us what makes your business stand out in the community. It's important we hear from you to tell us all we need to know about what you do best. Tell Us Your Business uses the latest radio and television production systems, and all shows can be seen on AMP2.tv. If you have a question for our guest, call 888-565-1470. Now, let's get ready as our guest hits the airwaves and informs us about what we need to know on Tell Us Your Business.
We're on, right?
We're
almost.
Hi, welcome. This is Lorena Anderson, your life and energy coach, otherwise known as the Energy Shifter. And today we have a special guest, Dr. Luis Escobar. And I also like to say hi to my co-host, Jay Feldman.
Hi.
He happens to be our business coach. So welcome to Tell Us Your Business. Dr. Escobar was very good in saying, this isn't quite a business. This happens to be a practice. I said, yes, I know. So tell us all about your practice. It's very, very important. You can reach us here. Please, if you have any questions, you can reach us here at 888-565-1470. That's 888-565-1470. You can also go on to amp2.tv and you can watch us live. So, enough being said now. Welcome. It's nice to have you, Dr. Escobar. I see here that you are in the Pain Care Specialist of Florida. Is that the name of your business?
That's correct.
Your practice.
That's the name of the practice, yes. Pain Care Specialist of Florida.
Oh, okay. Excellent. And I can see here that you have 3 different locations. Can you tell us where your offices are located?
Absolutely. Our main office is in Hollywood, Florida. It's on Sheridan Street. We have an office in Aventura and another office in Pembroke Pines.
Excellent. So, the pain specialist, tell us a little bit more about that. Share with us.
Well, pain management is a specialty in and by itself. We deal with acute and chronic pain. On the office base is mostly chronic pain. In chronic pain is defined anything that has lasted for more than 3 months. Without the normal response to relief of that pain.
Okay.
So we try to help our patients with a comprehensive approach, which includes physical therapy, rest, anti-inflammatories, interventional treatments, and if everything fails, we go to more invasive type of treatments.
Okay, great. So you not only use the physical therapy first, the non-invasive, and through that and different types of medicines, and if that doesn't work, then you do surgeries or?
No, I do not perform surgery. That would be a separate specialty. We try to keep our patients from having to go to the next level, which will be the surgical approach.
Okay, gotcha.
In our latest effort to try to keep our patients from having to move to that next level on the algorithm, we have introduced in the last few years what we call regenerative medicine. And what this is try to not only treat the pain, but also help the injured tissues to regenerate in order to return to a normal life.
Wow, that is really interesting. That is one of the cutting edges that is happening these days, from what I hear. I mean, I had a couple of my friends that I work out with at the gym, and one of them, he was talking about having to have knee surgery. And he said that instead of doing the surgery, what they were doing was building cartilage inside the knee. And I'm like, oh, does that happen? Any insight on that? Or I'm not sure how well it worked, but...
Absolutely. It's in the end of the day, that's what we're trying to achieve. Are we there yet? I think we're getting there.
Okay.
We are trying to help the body heal itself with its own products. So we use a combination of what is called mesenchymal stem cells. And by definition, a mesenchymal stem cell is a cell.
Say that one more time. It sounded like a mouthful.
Mesenchymal stem cells.
Okay.
And what these cells are by definition are cells that can reproduce and convert into a different type of cell.
Wow.
In other words, what they call progenitor cells. A cell that is in your bone marrow, for instance, can go, when isolated, with millions of other
Is that
cells
a
of the
hybrid?
same.
A hybrid cell?
No, it's not a hybrid. No, it's your stem cells, so to speak, is the beginning of the cells.
I see.
So we isolate those cells and put them into the injured tissue in an attempt to try to regenerate that injured tissue into a healing status.
Wow, excellent.
This is done in a combination of bone marrow, like you mentioned. That's an area where the stem cells live. Stem cells live pretty much anywhere in your body, the mesenchymal cells. Skin, bone marrow, adipose tissue, any organ in the body has different amount of this type of cells.
Mm-hmm.
They concentrate the most in bone marrow and in adipose tissue.
I see.
Now, once those, I'm sorry.
No, that's great. I'm excited. Yeah.
I know. It is exciting, isn't it?
When I get to talk, you cannot stop me.
No, good.
No,
we
but-
like that. We
no, we
like
want
that.
you to talk.
Okay, you know something? I mean, you're in a perfect place to talk, okay? This is
Thank
talk
you.
radio. So,
I get so excited about it because this is pretty much a turning point in medicine. At least in my practice, we're going from just treating some symptoms into trying to actually regenerate the injury
Yeah.
to at the same time get rid of the bad symptoms, which is pain. So I was another thing that we use in the past. The first regenerative treatments that were used was what is called platelet-rich plasma, and that is the platelets live in your bloodstream. They also exist in your bone marrow. So we were taking the blood from the patient, processing it via centrifuge, separating the different type of cells, the red cells from the plasma and the platelets, and injecting the platelets into the patient. The platelets have significant amounts of growth factors, cytokines, and anti-inflammatory components that were helping with the treatment, but they were
Wow,
not
yeah.
helping rebuild
Right,
the injured
right.
tissue.
so
now,
it's kind of like a Band-Aid then.
not a Band-Aid, but it would help with the own regeneration. What we're doing now, we added the mesenchymal cells to the platelet-rich plasma, and the mesenchymal cells are the ones that actually tend to heal the tissues, and the platelets and all the growth factors and cytokines are like the tools that the stem cells are using to rebuild that injured tissue. So
That is fascinating.
It is indeed.
So, Doc, if I may, it's almost as if you were creating your own enriched soup.
Basically, funny you say that because some doctors, the lectures, they refer to the soup that you could back
I like
into the
that.
tissues to try to regenerate them. Yes, sir.
That's
So,
very
so if you
interesting.
could create besides the normal vitamins that are intrinsic to the soup, you're really building blocks for added factors in the soup too.
That is correct. There's a caveat, and your statement is correct. The caveat exists is that we cannot manipulate those cells as for the FDA standards.
Yeah, that's what I was
So-
going to ask. Yeah, there's this great big controversy right now about stem cells. Can you elaborate on that?
Absolutely. The controversy that I've read about is what is caused by people overpromising results about stem cell treatments.
Oh,
And you see it all the time, the websites located outside of the United States most of the time, and they promise you they can cure anything and everything. And I don't think that is possible at this day and age. Maybe something that may be possible in the future, in the distant future, but not in this day and age. So we are realistic. We tell our patients that there's no guarantees that this is going to be a cure, but we are providing the tools for your body to regenerate itself. So that is the promise to the patient. We're giving you the tools, and hopefully your body will react.
Gotcha.
Obviously, this works a lot better on a younger person. The older you get, the less cells that you have. So at this point, we're not able to culture the cells. So we cannot. If you only have 2 cells, we cannot culture and give you 1,000,000 back. No, if you have 2 cells, we're going to concentrate them. If the 2 cells are separated in 100 cc's of your own blood or bone marrow, you're going to concentrate and put them together so you get the 2 cells to work. Obviously, 2 cells is the wrong number. It's millions of cells. So if you have 1 million cells versus 10 million cells, the results are going to be a little different.
Gotcha. Well, that's very interesting too, because you're harvesting your own stem cells. I know that there was a huge controversy about using the placenta.
Embryonic. No,
embryonic. Yes.
Embryonic are not allowed to be used in the United States by the FDA. They are being used in research, but not for clinical use. And I don't think there's going to be any need to use embryonic stem cells at all, because we are able to obtain dramatic results with autologous stem cells.
Wow, okay.
Doc, I was going to ask you, it makes it very vivid for patients if they can understand which particular types of diseases have you been successful the most in?
Well, I specialize in pain management and mostly practice these stem cell treatments on musculoskeletal type of diseases, shoulder injuries, knees injuries, hips, spine, herniated discs, facet joint diseases. And those are the treatments that we are focusing on. But there's plenty of literature available in the use of mesenchymal stem cells in other diseases, neurological diseases such as multiple sclerosis.
Really?
Yes, there's some research on pulmonary diseases such as COPD, chronic obstructive pulmonary disease. In any disease at this point can be amenable to this type of treatment. It's not what we do in my practice, but there are plenty of reports in the literature of positive results.
Wow, that's very interesting.
And it sounds like your relationships, do you get referrals from other physicians? What's the mechanism of how you're seeing patients too?
It's we do get referrals from other physicians. The treatments of stem cells and platelet-rich plasma are still in its infancy, and there's a lot of skeptical people around, namely physicians and the general population, and rightly so. As you mentioned before, there has been a lot of controversy and a lot of people who have taken advantage of other people over-promising what's not available to be promised at this point.
Now, I would think that they're building the research and everything on the curing factors here and how you get to regenerate the tissues for the healing process. Is there any research outside of the United States where any other type of stem cells have been used and the prognosis is really, really good?
There's research all over the world, yes. I think we have plenty of good research in the United States with good studies with good results.
Excellent.
We're not talking about cloning or that type of.
Although I've heard that happening,
it does happen, and they're doing it, but that's a completely separate story altogether. That's not what we're doing here. We're trying just to help regenerate injured tissues, from the components of your own body. It's autologous. Everything is yours. We try to get your own stem cells to help regenerate your meniscus in your knee, if you will. And we're not trying to give you another knee so you have 3 knees. No, we want you to have your own knee that back to a very functional stage. And if we're successful, and there's plenty of studies that prove that it is, help that patient avoid meniscectomy, which is surgical resection of that meniscus, and have the meniscus regenerate itself. That will prevent the complications of a meniscectomy that are, in the long term, resection of a meniscus may contribute to the need of having a knee replacement 10, 15, 20 years from now,
Oh,
or
isn't
30
that
years.
fabulous?
So that would be a great advancement for sure.
I'm telling you, I'm so excited because I have another dear friend, and his doctor continues to tell him, wait until you can't stand the pain anymore. Wait, do not get a knee replacement. Wait until you can't stand the pain. And I'm like, no, why would you want to do that? Because the body is healing better at this age than in another 10 years. Hello.
Yes, but I understand where the surgeon is coming from, and I agree with that statement, because when you do a knee replacement, there's a limited lifespan to that surgery, and not because it's a bad surgery, it's because the materials don't last that long.
Absolutely.
The wear and tear is going to, in an average, give you 10, 15 years, maybe a little bit longer now with better materials, but that in the past, that has been the average of a good replacement surgery.
Right.
So if this patient, in the meantime, while awaits a surgical replacement, undergoes a treatment with stem cell and platelet-rich plasma, and we can get rid of that pain. I'm not think that is going to prevent that person from having the knee replacement 10 years from now, but it's going to make it a lot more comfortable in an interim. And who knows? Maybe we'll need the knee replacement. Maybe
I love that. I'm going to take your card. I'm going to give it to my client. Absolutely. Because let me tell you, I mean, thank you. Okay, I've got the card now.
Her knee's getting ready as we speak.
She had given me the card.
Well, because it had your addresses on. That's why. But no, I wanted to give it to my client.
Because I forgot my address.
Well, you never know.
Dr. Escobar, I'm always fascinated by the journey that people take on, both on their passion and the differentiation of their life. And you started out as an anesthesiologist, so tell us a little bit about that journey to how you got to where you are today from there.
Absolutely. Anesthesia is two parts of the practice of anesthesia. One is the general anesthesia, and the other one is the regional anesthesia. Now there are more parts nowadays because there's multiple subspecialties in the anesthesiology specialty. But in essence, when it comes to giving anesthesia for surgery, those are the main parts: regional and general. Regional is pretty much very closely related to pain management, interventional pain management, which is what I did and I'm still doing, and now together with the regenerative medicine. So I was already trained on most of the interventional treatments and the blocks and injections here and there. So I did extra training into the pain management part to apply the treatment of the chronic pain, and that's how the transition happened. At the beginning of my career, after training, I did do both anesthesia and pain management, and then eventually I like to do the practical part. Yes. Some people say that I'm a frustrated surgeon, but I like the practical, the injection part, and that's why my practice developed more into the pain management than the anesthesia. And at this time, I do not do any more anesthesia because the practice of pain management and the regenerative medicine, it takes all my time.
Oh, yeah. Well, there's a lot of people out there in pain.
Yes, unfortunately.
Amen to that.
But no, amen to you that you're there to be able to help them. That's excellent.
That is our job for sure.
Yeah. Well, why don't you give us your name again, your telephone number, so that they know how to reach you?
Yes, my name is Dr. Luis Escobar. We have one phone number that we use for our offices, so it's easy to remember, and the number is 954-322-8586. And we have an office in Hollywood, another office in Aventura, and another office in Pembroke Pines. Excellent.
And Jay.
Yeah.
How are you doing over there?
I'm doing great. I'm fascinated after hearing this story from the doc.
Yeah, I know. I agree. How did they get a hold of you, Jay?
They can call me at 954-763-2505 or email me at j@jfeldmaninc.com.
Okay, great. Our business coach extraordinaire. And also, he's got a lot of financial background as well. So which is very, very important in the business field. You have to know
Absolutely.
about your dollars. That's great.
Thank you.
That's great. So, is there? Give us some. Where's the research going now? Okay, you talked about how things are starting to come around with the stem cell activity. What do you see on the horizon? What do you see that's coming up that's going to be really astounding for all of us?
Well, the implementation of what we have available now it was going to be outstanding if we get more patients to opt for the regenerative treatment as opposed to the palliative treatment or the surgical treatment. I think that we are already at a turning point. And it's a matter of education and perhaps the turning point will be when the insurances will cover for these treatments.
You took the words right out of my mouth. That's what I was going to ask. Is insurance covering the stem cell treatments?
Not at this point.
No, it's kind of like cosmetic, right?
It's basically yes. Is not covered by the insurances and is a patient sponsored, as we were mentioning before, patient sponsored medical treatments.
Gotcha. And it's too bad too, because this could really save so much money. The insurance companies could really it's part of the prevention. If they don't have to go into surgery, I'm not sure that the surgeons might like that much, but I take it back. I think surgeons would rather the body heal itself instead of having to go in and do something, do surgery on it, open up the body.
I believe so. Surgeons, obviously, like me, they like to stick things and fix things manually, but surgeons have undergone transitions over the years, and they train in new techniques and add one thing to another. There are orthopedic surgeons that I know that are using stem cell as an additive to promote the healing of the surgery they're performing.
I love that.
And that is already happening. You may do that as before the surgery to make the surgery better, or you can do it after the surgery if the patient did have the surgery, going back to the meniscectomy patient. If the patient had the meniscus surgery and it's a successful surgery, but the patient still has pain, then that would be a perfect patient to treat with the stem cell and platelet-rich plasma to treat the symptomatology and continue the healing process. Patients who have, you mentioned the knee replacements.
Yeah.
Many patients who have had a knee replacement have continued pain after the knee replacement, and those patients can benefit from treatment with stem cells and platelet-rich plasma as well, because most of the time, the surgery is perfect. You look at the x-rays, the knee is in perfect place. There's no loosening of the prosthesis, but the patient has a lot of pain. If we treat all the ligaments and tendons and all the soft tissues around it with stem cell, the symptoms improve.
Wow.
So there are indications even after surgery.
Excellent. That sounds amazing. That sounds amazing. Now all we have to do is get insurance to cover it so that we can really get the patients some relief. I mean, because that's going to add to the quality of life. And when you have quality of life, you have quantity of life as well.
Absolutely.
That's very
also,
cool.
perhaps as the trend accelerates to non-invasive from invasive, that trend would be helpful to promote this too.
Well, I think nobody wants to have surgery if they can avoid it. So I think it's just a matter of affordability at this point.
Yeah.
If surgery is covered by insurance, but the stem cell treatment is not, I mean, most likely the majority of patients are going to go for the surgery because nobody has all that much money set aside just to go and treat their knees or hips.
Exactly. What is the normal time that people can feel results from doing the stem cell?
Well, there's a two-stage result. We expect the symptomatology to respond relatively quick, in a matter of days.
Okay.
The regenerative part is going to take longer time, obviously, and it depends where we start from. If we're trying to rebuild cartilage on a knee, it's going to take anywhere from 4 to 6 months to actually see some result. If we try to repair a tendon or a meniscus in a very young person, the tendon will heal a lot faster than the meniscus because the meniscus doesn't have any circulation. But that's going to be faster than the trying to reproduce some cartilage chondrocytes into an older person. So it varies, but 6 months would be a good estimate on how long you would expect to have some results for value or for failure. And I wouldn't give it up before then.
Okay. How many treatments would an individual need?
Usually, traditionally, a platelet-rich plasma, we do a series of treatments. When we do the combination of the stem cell and the platelet-rich plasma, it's usually one treatment, and you may have a booster a few months after if necessary, depending how the symptoms are.
Gotcha. Well, that's very interesting. I do remember this was probably about 4 or 5 years ago when I was talking to you about the gentleman who had decided to create cartilage in his knee. And I said, well, how long is that going to take? Now, mind you, this was probably about 4 or 5 years ago. 2 years. I said, 2 years? Okay. And he had a brace on, and he had a tough time. So, I mean, I'm impressed. If it's taking anywhere between 4 to 6 months, that is wonderful.
To see some result. I'm not saying that it's going to be a cure full of cartilage.
But at least it's got some result, though, to it.
We would expect some difference in the joint after 6 months.
Well, I thank you so very much for coming and being on the show with us today.
No, my pleasure. Thank you for having me.
It was great.
Good to spend time with you, Doctor.
Yeah. Thank you for coming, Jay.
You're
It's
welcome.
always a
Always
pleasure.
good to be here.
Always a pleasure. And I'm Lorena Anderson, your life and energy coach, otherwise known as the Energy Shifter. And you can reach Jay. What's your telephone number?
954-763-2505.
And Dr. Escobar?
954-322-8586.
And Lorena Anderson. And you can reach me at 954-647-5525. Thanks again, and come and join us again next week when we're back. Tell us your business on Monday evenings from 6:30 to 7 o'clock.
This has been Tell Us Your Business, where a special guest comes on every week and tells us what they do. All shows can be seen on amp2.tv, and if you wish to be a guest, call 866-224-5422 and tell us about your business. That's 866-224-5422. This has been an amp2.tv production.